Hello and welcome back to part 3 of systemic interpretation of the ECG. As a professional who wants to effectively interpret the ECG, you must follow it in a stepwise procedure, which part 1 talked about the regularity and the heart rate, part 2 talked about the diagnosing of the P wave, P arrow interval, and analyzing the QRS complex. Today we are going to talk about the ST segment, the T wave, and the QT interval. The ST segment starts from the end of the S wave and ends at the beginning of the T wave. Looking at the ST segment, you want to find out if it's elevated or depressed. And for you to easily do that, you have to understand the concept of isoelectric line and J point. The isoelectric line is the baseline of an ECG tracing. In simple terms, it is an imaginary straight line that cuts across an ECG lead when you remove the upward and downward deflection. The isoelectric line is the straight line which you compare your ST segment to see if it's elevated or depressed using the J point as your reference point. The simplest way I can put J point for your understanding is the junction where the end of the S wave and the beginning of the ST segment meets. For example, if the J point is at the same level with the isoelectric line, the ST segment is considered to be normal. If the J point is above the isoelectric line, the ST segment is considered to be elevated. If the J point is below the isoelectric line, the ST segment is considered to be depressed. For more information, I plan to do a future video on ST abnormality and myocardial infarction, so please watch out. After analyzing the ST segment, you want to analyze the T wave. You want to check if it is present, if it is upright, if it is downward, if it is peak T wave, which is suggestive of hyperkalemia or early signs of myocardial infarction. Lastly, in your systemic interpretation of the ECG, you can look at the QT interval, which measures from the beginning of the Q wave to the end of the T wave. Normal QT interval is between 0.35 to 0.45 seconds. Please note that there are different normal values for both male and female. However, a QT interval of 0.47 seconds is prolonged. Well done guys, we have come to the end of this session. For emphasis and summary, try and follow these steps displayed on your screen when next you are reading an ECG. Make sure you do this religiously.